Hi, this is Dr. Michael Cerami back for another edition of our helpful videos. This video today will explain a little bit about options and some ideas after your first visit. Our goal at our office is an informed, educated healthcare consumer. There's a lot of information out there in all categories today. Healthcare can still be very overwhelming. It's one of the few disciplines or industries that the patient has very little control over and very little understanding. So we find by providing as much information as we can ahead of time or in concurrent with the office visits, you folks get a better understanding of what we're trying to achieve and how you can help yourself as well. So today's topic is progress or after your first visit. So this is after your initial visit of review. So once we do the initial examination, what we're going to do is review what your options would be and go over, what the roadmap is from that standpoint. This information is also in the new patient booklet that we provide. Initially, there are, I think it's on page 8, there are 4 usually main issues that cause problems that people come in with in 4 categories. Number 1 is muscle imbalances and weaknesses. Number 2 is biomechanical and joint misalignment of the spine and extremities. 3 is soft tissue inflammation, post-injury trauma and pain. And number 4 is neurological integration, or what we call neuroplasticity. So between these 4 categories, we find that that probably covers at least 90, maybe 95% of the problems that people come in with. What that means is that the problems may be equally dispersed among those 4 categories, or it may be weighted more heavily in one category than another. There may be a whole lot of muscles that are shut down and some compensation here. There may be a lot of biomechanical misalignment and less muscle, but we'll evaluate and then break these categories down and talk about how we're going to fix each one of those. So once we get an idea of what the physical exam shows us, we do some measurements and we test a bunch of things, we'll make a recommendation. For most people, that'll be about 2 to 6 visits to correct some of these things. We want to really grab the stuff that is the most important to start with and fix those. And that is usually going to be the muscle imbalances and weaknesses, and we'll fix that with the AMIT protocol. Once we make those recommendations, that's kind of our flow chart here. As I said, for most people, it's going to be, depending on the chronicity or how acute the problem is, it's going to be about 5 or 6 visits. We'll do a progress exam at the end of those visits, and we're going to evaluate and give you a little questionnaire and ask you how you're doing. We're going to make it real simple. The category that you're going to fit into is either you're going to be above 50% improvement based on functional and symptomatic changes. So how you feel, but also how things are working, how things are moving. So you're either going to be above 50% or below 50%. Now, the vast majority of people fit into this category, but there are some challenges and some situations that are a little bit unexpected. If you fall into this category during the progress exam, then we're going to recommend stabilization visits. And what I mean by that is these visits are a little less frequent, and what we're going to have you do is add back into your lifestyle, your activities that you like, some things that you hadn't been able to do. And we're going to check in on a regular basis. So we're going to ramp up your activities and make sure that we get sustainable changes from this correction. We're also going to be doing a little bit more of this work, but we're going to basically have you take the car back on the racetrack, double check to make things are working, have you push it a little bit harder every couple of weeks, and make sure that we're getting sustainable change. That usually will take a few weeks to do that, and then we'll check in again at the end of that. If by chance we're not getting significant change, and by that I mean 50% or above, we're going to have to dig a little bit deeper. There might be some things going on here. Now, in my 34 years of practice, there's always outliers. Sometimes cases look very straightforward initially and they're more complex. Sometimes they look more complex and they're very straightforward. If we have a less than a 50% change, what we're going to do is probably send you out for some imaging. That may include an X-ray, an MRI, just so we can look a little bit deeper and find out maybe what else is going on in there functionally, or it could be a congenital problem, there could be other more long-term damage. Our treatment protocols following that would be a combination of microcurrent. We have 3 different lasers at the office that we're going to use that are very effective. There's a lot of data on our research about that. Hyperbaric chamber, nutrition, and some lifestyle maybe adjustments. So combination of these things, we're going to usually recommend that we dig into that a little bit more and schedule another few visits and see if we can get some changes with that. The reason I provide these videos, and especially this one, is we really want you to understand again where you're going, what the roadmap is. If we have a plan to drive to LA, more than likely we have to go through Las Vegas at some point. And this is sort of our checkpoint along the way. Or are we in Las Vegas? We're not quite at our destination yet, but we should be getting there. And let's pull over to the side of the road and then evaluate. I think this is a very pragmatic and a practical approach because we want to make sure the patient feels that they're getting success. And if they're not, we need to recheck the map, recheck our coordinates, and make sure that everything's still going on the right direction. Maybe we've got a little bit off course, but we want to make sure you're comfortable with the approach that we take. Okay, that's about it for today. If you have any questions, please leave them below. And don't forget, if you like our videos, please subscribe and share. Thank you very much.